With us today is Deborah Clegg, Professor of Internal Medicine at Cedars-Sinai Medical Center, to discuss the management of hyperkalemia. Welcome, Dr. Clegg.
Thank you.
Dr. Clegg, how do dietitians typically manage hyperkalemia in patients with CKD and ESRD?
Okay, well, this is a great question. So the first thing you do is that there are four major concepts that you have to take into consideration. The first is once you see an elevated level of potassium, you have to determine, is this truly a real value? There are lots of spurious measurements of potassium, and so you want to make sure that this is not a case of pseudo-hyperkalemia. And what you would do there would be you would look to see whether there was any problem during the blood draw. Was there any excessive fist clenching with the tourniquet on during the blood draw? Does this patient have an infection with an extremely high white blood count? Was there any hemolysis of the blood? So basically what you want to do is you want to establish that indeed this measurement of potassium is indeed elevated. Once you've established that it is indeed an elevated level of potassium, then you begin to interrogate the patient a little bit further. Has there been any change in their food intake? And specifically here, they may say, oh, no, I'm eating the exact same types of foods. But what you would want to probe would be, there might not be changes in the food per se, but perhaps there's changes in the way that the food has been processed. An example would be perhaps they're typically used to dialyzing their potatoes, putting them in water and having the potassium leach into the water. But now all of a sudden they decided to have a baked potato, which is significantly higher in potassium. So you would sort of want to interrogate the individual about not only the types of foods that they're consuming, but also the way in which the foods have been processed. Once you've established that maybe there's no change in the foods and that the potassium elevation is indeed real, the next question you might want to ask your patient is, have you had any changes in your bowel habits? Specifically, when our patients get constipated, this is a way in which you lose one of the ways that the body releases potassium. So you'd want to find out, are there any changes in your overall constipation or in your bowel habits? Oftentimes our patients are on medications that induce constipation, so it's really important to see whether there's been any changes. And the last thing you would want to do would be to ask the individual, have they changed any of their medications? Specifically, did the physician change any of their RAS blockers, specifically their ACE, ARB, or aldosterone, or some sort of medication that might elevate serum potassium levels? Or one of the common things would be that maybe the patients are now taking some NSAIDs, and perhaps this is also another source of increasing their level of potassium. So once you see a patient with an elevated potassium, especially if this is not their typical case, you'd want to go through one of these four things. You'd want to first confirm that indeed the potassium has been elevated, that there's no pseudo-hyperkalemia. You'd want to probe and interrogate the types of foods that the individuals are eating, specifically looking at any changes in the processing of the foods. You'd want to ask them about their bowel habits, and lastly, you'd want to make sure that there were no changes in overall medications, specifically focusing on those that would cause hyperkalemia.
Different institutions have different guidelines for serum potassium threshold levels. How does this impact patients with hyperkalemia?
This could impact them a lot because perhaps they go from being an inpatient in the hospital and all of a sudden they go to their dialysis unit. Perhaps while they were in their inpatient unit, they were told that they had hyperkalemia with a potassium of maybe 5.3, and then they go to their dialysis unit, and even though it's slightly higher, they're not diagnosed with hyperkalemia. And the reason this is there's actually no clear definition as to a specific lab value that's associated with hyperkalemia. And this is important because it's really important to look at it as an individual case-by-case basis. And so what you want to do is you want to ask your patient, get to know your patient, get to know their relative history related to their potassium levels. It's really important that if your patient has some sort of underlying disease, specifically a cardiovascular disease, they may be incredibly sensitive to small perturbations or small changes within their potassium. And so you really want to look at their overall rate of change. If your individual has chronically been coming in with maybe a potassium of 5.3 and then all of a sudden it jumps significantly, this is when you have a reason to be concerned with respect to the potassium level. But the bottom line is that there are no clear definitions as to what hyperkalemia actually is. And so it could be very confusing for a patient because they may be in one institution and be told that their potassiums are normal, and they go to another institution and their potassiums may be elevated based on that institution's guidelines. And again, these guidelines may change based on the way that the blood is processed within the institution, whether they use those pneumatic tubes where they transport the blood over to the lab. This can change the levels of potassium within the blood. There's many different variations with respect to how potassium is actually measured within the laboratory setting. So that's one of the reasons there's no clear definition with respect to hyperkalemia. But the most important thing is to know your patient and be aware if there's any sudden rapid changes in their potassium levels. That is a cause for concern.
The new dietary guidelines for Americans indicate that healthy individuals should consume approximately 4.7 grams of potassium per day. How can this be achieved?
This is really exciting, and it's an exciting time for potassium because all of a sudden it's now been listed as a nutrient of concern, and basically what we're trying to do is encourage people to consume so much more potassium than what they're currently taking in. And one of the reasons of this is that there are so many wonderful health benefits associated with potassium. It lowers blood pressure, it's associated with improvements in overall bone homeostasis, it reduces your risk of stroke, so it's really, really important to eat a diet that's elevated with respect to potassium. So now how do you actually go in and encourage people to do this? Well, the dietary guidelines suggest that we have 5 portions of fresh fruits and vegetables per day, and a portion is about the size of your fist. And so what we want to do is we want to encourage people that when they're eating fruits and vegetables, that they're as fresh as they possibly can be. When the fruits and vegetables have been processed, you lose so much of the potassium with a processed fruit or vegetable. So one way that we can actually encourage individuals to get those that full amount of potassium that we're now encouraging is to eat it as fresh as possible. So you want to have a fresh piece of fruit. You don't want it to be canned or stewed or soaked or any of the ways that typical people are now eating their fruits and vegetables. You want it to be directly as fresh as possible. Again, the other thing you want to do is, even though we recommend that you increase the amount of potassium in your diet, we don't want that to come from salt substitutes. Salt substitutes are loaded with potassium. There's other drugs that are also elevated with respect to their potassium content. When we say to increase the amount of potassium in your diet, we really want that to come from dietary sources. Because quite honestly, at the end of the day, where we admit that it's important to have elevated levels of potassium in our diet, we don't know if it's the potassium per se or the foods the potassium is actually in that causes the beneficial effects with respect to stroke and cardiovascular disease and the like. So what we really are trying to encourage is at least 5 servings of fresh, again, not processed, fresh fruits and vegetables. And again, a serving is about the size of your fist. So we're really trying to encourage incorporating these fresh fruits and vegetables into your diet.
How can the emerging therapies impact diet liberalization in CKD and ESRD patients?
Well, this is such an exciting time for these patients because for so long we've imposed a very strict diet on these individuals. Quite honestly, it would be incredibly difficult to follow. We ask them to keep their protein intake down. We ask them to keep their potassium intake down. And it's really, really difficult to follow. With these new binding agents, we now may have the opportunity to liberalize the diet so that these individuals can take in a little bit more protein. They can take in a little bit more of the fresh fruits and vegetables that bring in on the potassium. By liberalizing their diet, we're incorporating not only the benefits with respect to the potassium, as I said earlier, but also the other nutrients that come along with potassium-rich foods. So by allowing these individuals to also be on the medications that help keep their blood pressure lower, those same medications are often associated with elevating their potassium level, which puts them in this unfortunate catch-22. Do we provide them the medications that are beneficial with respect to their blood pressure, or do we decrease the amount of those medications because they're getting into trouble with hyperkalemia? So with these new binders, what we can do is we can liberalize the diet, maximize the medications so that we can put the individual at their best health and well-being. It's quite interesting to note that our forefathers, back Paleolithic days, millions of years ago, they were consuming diets that were insanely high in potassium. So the kidney has this incredible ability to process elevated levels of potassium. But in our today's environment, where we've gone from basically a plant-based diet to one that is filled with agricultural processing of our food choices now come with high in sodium and very low in potassium. This is exactly not the type of foods that we should eat for cardiovascular health. So with these new binders, we're going to be able to liberalize the diet, maximize the amount of medications the individuals are taking, and not have to worry as much with respect to the elevated levels of potassium.
Do you have any concluding thoughts?
No, I just think this is an amazing time. Potassium has just been this little mineral that hasn't probably had a lot of attention paid to it, but now all of a sudden we're realizing that this mineral has so many benefits associated with it. And now with these new binders, we really can start to learn much more about the benefits associated with potassium, and really I think we're going to radically change the health and welfare of our patients with chronic kidney disease.
Thank you for spending some time with us today.
Thank you.